Are diclofenac tablets safe? Diclofenac tablets, when used as directed and under the guidance of a healthcare professional, are generally considered safe for use. Diclofenac is a nonsteroidal anti-inflammatory drug, NSAID, that is commonly used to relieve pain, reduce inflammation, and treat various conditions such as arthritis, menstrual cramps, and migraines. However, like any medication, diclofenac tablets do carry some potential risks and side effects. It is important to follow the prescribed dosage and instructions provided by your healthcare provider to minimize the likelihood of experiencing any adverse effects. Common side effects of diclofenac tablets may include stomach upset, nausea, dizziness, and headache. These side effects are usually mild and temporary. In some cases, diclofenac can cause more serious side effects such as gastrointestinal bleeding, ulcers, or liver problems. It is important to discuss your medical history and any pre-existing conditions with your doctor before starting diclofenac treatment. To ensure the safety of diclofenac tablets, it is crucial to adhere to the recommended dosage and duration of treatment. It is not advisable to exceed the prescribed dose or use diclofenac for extended periods without medical supervision. Here's an example to further illustrate the safe use of diclofenac tablets. Sarah, a 40-year-old woman, has been experiencing knee pain due to arthritis. She visits her doctor, who prescribes diclofenac tablets to manage her pain. The doctor explains the recommended dosage and advises Sarah to take the medication with food to minimize the risk of stomach upset. Sarah follows her doctor's instructions and takes diclofenac tablets as prescribed. She experiences some mild stomach discomfort initially, but it subsides after a few days. Sarah continues taking diclofenac for the recommended duration and attends regular checkups to monitor her response to the medication. In this example, Sarah's doctor ensures that diclofenac tablets are safe for her by prescribing the appropriate dose and monitoring her progress. Sarah follows the instructions and experiences only mild and temporary side effects, indicating the safe use of diclofenac in her case. Remember, it is essential to consult with a healthcare professional before starting any medication, including diclofenac tablets, to ensure its safety and effectiveness for your specific needs and medical history.